I'm Dr. Rasla Parween, working as a radiation oncologist in Victoria Hospital, Bangalore. So today I would like to talk about cervical cancer and guide you through the signs and symptoms of cervical cancer and what are the risk factors of cervical cancer. So primarily cervical cancer affects women and it is most common in, especially in India, it is a highly prevalent disease. So we are trying all ways to reduce the burden of cervical cancer by increasing the awareness of the same. So coming to the signs and symptoms of cervical cancer. So what are the common symptoms that we see in cervical cancer patients? So some of the symptoms are there can be increased vaginal bleeding, white discharge per vaginum or abdominal pain. In case you come across any of these symptoms, you have to take immediate medical attention. So these can be very subtle symptoms, but knowing these symptoms are important because early detection is the key to cure. So the risk factors are most commonly infection, and specifically speaking, human papilloma virus infection is the most common risk factor, and followed by early sexual activity or multiparity, smoking and immunocompromised states like diabetes are the other, to name the other few. How do we prevent these are? One is by early detection. So early detection can be done with screening. Now, screening in cervical cancer is advised for anyone who is about 21 years of age or who starts their sexual activity, and it is advised up to 65 years of age. So, usually screening is done with pap smear and HPV DNA test, but these are very simple tests and is usually not painful, and the benefit of it will outweigh the results. So regular screenings are advised for patients for individuals above 21 years of age. So between 21 to 30 years of age, pap smear is advised every 3 years, and about 30 years of age up to 65 years of age, we recommend pap smear and HPV DNA testing every 5 years. So these screening has to be followed up to the age of 65 years and then can be stopped if the last 3 tests were normal. So coming to another prevention is the HPV vaccination. So HPV vaccination is very important to prevent 90 to 95% HPV infection. So this is advised in individuals, both boys and girls above the age of 11 to 12 years, and it is usually taken as 0, 2 and 6 months doses. Treatment options will vary depending on the stages. So it is important to meet an oncology team and individually tailor the treatment according to your stage. So we divide usually the cervical cancer to early stages and locally advanced stages. In early stages is where we prefer surgery, and in locally advanced stages is where we prefer radiation along with chemotherapy. So it is a multi-modality treatment. There is option for surgery, radiation and chemotherapy in cervical cancer depending on the stage, and it is this multimodal treatment which will improve the outcome and hence improve the survival. After treatment, it is important to stick to a strict follow-up. So first 3 months, monthly you should visit your oncologist, and then every 3 monthly for up to 2 years, and then every 6 monthly for up to 5 years. After that, yearly visits are sufficient. But this also depends upon your oncologist because of your symptoms from the last follow-up. Based on that, we will decide whether it should be more regular follow-up or yearly follow-up. So this has to be strictly followed for adequate cure.